Hello everyone. It's nice and sunny today, and you don't get that a lot in the UK. I thought of making this short video to guide anyone who is preparing for the FY2 Standalone Interview. I'm aware that the interview is happening at sometime in April, and that's usually when it happens each year. And I'm not here to talk about the very specific details of the interview. You should be aware of that, and I'm sure there are many other videos talking about that. But what I'm here to talk about is what I consider the golden advice for the interview that nobody talks about, and most of the people are not aware of it. And this piece of advice is what I believe helped me score very high in the interview. While it's very tempting to talk about all what you know about any particular subject in the interview, you need to pause for a minute and ask yourself, what is the consultant expecting from me? If I am him or her, would I hire myself? And to make it clear and give you an example of what I mean, let's say you are given a scenario about a patient who is presenting with chest pain. And through the assessment, through the questions, you get to diagnose that this patient is having tension pneumothorax, for example. And you were asked about how are you going to manage this patient. First of all, you must talk about the ABCD approach. That's a must. If you're not saying that, you're not going to score very well in the interview. But after that, after you did the management, the initial assessment of the patient, you'd be very tempted to say, I'll rush him, put a chest drain for this patient. And that's completely wrong, because you are a junior doctor and you need to always remember that. And it's not demeaning to think about yourself in the interview as a junior doctor, even if you have an experience bigger than this. But it's just you're showing them that you are a safe doctor. What you need to do and what's expected from you is to do a very proper assessment that will guide you and will make you reach the diagnosis. And then you talk about the initial management plan. Like, for example, in this case, you will say, if you are competent enough, you will do the needle decompression. And while you are aware that this patient will need a chest tube or chest drain, it's not you who is going to do this. You will call the relevant registrar or the relevant senior, and they will take care of that. You need to mention that very clearly. If the patient's airway is affected, you need to support that with the adjuncts as per the ALS protocol, and you need to revise that before the interview. If the patient is desaturating, you need to give them the oxygen therapy, and the initial management in this particular case is just to do the needle decompression if you are competent to do so. But don't be tempted to say that you'll do everything for the patient, even if that's the definite treatment, and even if you are competent to do that in your home country, and even if that's the right thing to do for the patient. That's very important, guys. What the consultants are really keen to see is that if you are a safe doctor, that they can trust in the assessment and the proper escalation, and that you can be one of the junior doctors at their team. You can apply this to any station in the interview, even in the ethical stations. If you are asked to do any difficult conversation with the patients or the patient's relatives about end-of-life management or DNA CPR, it would be very nice and very important and very reassuring to the consultants to be aware of your limits as a junior doctor and talk about proper escalation and asking one of your seniors to be involved in that discussion. But in the same time, you show them that you are aware of these kinds of protocols and you are aware of when to use them. I hope my idea is clear to you guys. Just remember this, please. There is no contradiction between showing how knowledgeable you are and, at the same time, reassuring the interview panel that you are a safe junior doctor that they can trust to be one of the doctors in their team in everyday practice. Good luck, everyone.